Okay, hello everyone, and welcome to our very first Thrive Aid Wellness webinar, brought to you, of course, by Thrive Aid. Now, my name is Priscilla Muziamba, and I'm honored to be your moderator for today's session. As I've mentioned, this is the very first in our brand new series that we're calling the Thrive Aid Wellness Series. Now, this series was created to hold space for important conversations that's around mental health, that's around self-care, sexual and reproductive health, gender-based violence, you name it. Now, these are not just topics. They are lived realities that affect our communities every single day. Now, our goal with Thrive Aid is simple. It's to empower, to inform, to support. And whether you're here as a professional or as an advocate or someone on your own personal wellness journey, I'd like to say that we see you as Thrive Aid, and we are so glad that you are here. So thank you so much once again for joining us. Now, if you're here for the very first time and you're not exactly sure what we as Thrive Aid do, well, Thrive Aid is a youth-focused nonprofit organization whose thematic areas are around mentorship, education, and mental health. Now, our goal or our mission as Thrive Aid is to aid young people in actualizing their potential and capitalizing on their abilities to achieve success. So please do sit back and enjoy this session, because today we have a very special guest in our midst. Now, before I get to that, I'd just like to highlight some of the works that we do around wellness as Thrive Aid. I would like to make mention that with regards to mental health, we have participated in a number of initiatives. For example, some mental health talks that we take part in at Fountain of Hope Orphanage right here in Lusaka, Zambia. Apart from that, recently we took part in the first and second edition of the Mental Health Bonfire. That is something that was hosted by the Mental Health Unity Foundation. Apart from that, we also collaborated with the Ministry of Development and Social Services in a campaign that was called the Public Awareness Campaign Against Arms to Children on the Streets. Now, please do follow us on social media platforms for you to get a feel of what we as Thrive Aid do, but there's so much that we have to offer. You can find us on Facebook, you can find us on YouTube, and LinkedIn as well. So please follow us on our social media platforms, even as we continue with this discussion. So thank you so much for being here with us. Now, our guest, without further ado, today is someone very special to Thrive It as well. It is no other than Wakumbu Simukonda, who is the PATA Field Technical Advisor here in Zambia. And we're going to be looking at breaking the cycle and understanding the impact of substance abuse on self-care and mental health. Now, last month, we commemorated the National Youth Week 2025. And some of the key themes or key topics that came about were with regards to mental health and substance abuse, especially among young people. We want to understand what issues young people are facing with regards to their mental health, and how is substance abuse affecting mental health and overall self-care. Now, before I let the speaker just say one things about himself, I would like to make mention that if you have any comments, any questions, please do drop them in the chat box and I'll be able to attend to them. And if you'd like to speak out, just raise your hand and we'll be able to give you some time to just make your contribution. Now, before I go on and on, without further ado, I welcome Wankumbu Simukonda to this webinar. Wankumbu, please unmute your mic and please tell us a bit more about yourself. But otherwise, welcome to this webinar.
Thank you so much, Priscilla. And by you, victim. noise. Grace Nkongela, if you could mute your mic, please. Okay. His mic is open, so I'm getting some feedback. So, but yeah, like I was saying, I always do appreciate, and I'm greatly honored to be invited by Thrive Ed to feature on its inaugural, the first ever of this kind of webinars. And I hope that the insights that I'm going to share are going to resonate with one or two of the participants that have joined us on this call, and really just me sharing my experience and interaction with many other adolescents and young people in society. So I'm super excited to be here. Thank you so much.
Thank you so much for that, Wankungu. Now, even as we get into our discussion, just as some form of an icebreaker, just to get ourselves comfortable, would like to ask you a question. With regards to how you're feeling today, with regards to your mental health, and if, let's say, it was you reporting the weather forecast today, how would you describe your mental health? Is it sunny? Is it partly cloudy? Is it stormy?
Well,
Mm-hmm.
that's pretty cool. And I think I would say partly cloudy. I think that's how I would describe my mental well-being, because when you said if I'm going to describe my weather, then I started trying to remember what we used to learn in journalism about weather description, and then I'm like, okay, will I remember those kind of terms? But thanks for giving me a leakage. But yeah, I'll describe it as partly cloudy. Yeah.
Okay. Well, we won't get the nitty-gritties of why it's partly cloudy unless you want to share. Okay. So this applies to everyone who's joined in, whether you're watching it now, whether you're going to watch it after the meeting has already been recorded. Please do drop in the chat box. We want to know how you're feeling. This is a wellness webinar, and we're supposed to be here for each other. So please do drop in the chat box. Tell us, how are you feeling? Is it sunny today for you? Is it partly cloudy? Is it stormy? Are we expecting a thunderstorm? Let's feel free to interact with each other even as we continue with this webinar. Now, Wankumbu, to the time we've been waiting for, let's just dive into this session. Now, first question, how did you get to the point that you're at? What do you mean when you say you are the Patterfield Technical Advisor? How is it related to self-care? Are you able to explain to us, or just give us a brief background of how you got to that part in your career?
Thanks so much, Priscilla, for that. And I always share this part of my story as a way of just trying to inspire a young person who is in either university or college, because I always share that, passion, determination, and how hard work really pays off in one's career. And I think for me, this is what has happened over time, because I think, I went to the University of Zambia as an undergraduate student in 2017. When I went there, I joined a team called the University of Zambia HIV and Sexual Reproductive Health Response Team. And the response team has shaped my career over time. Through that, I attended my first ICASA conference in 2019. I attended various high-level meetings in 2019, 2020. I hosted a number of radio shows around sexual reproductive health and rights, as well as COVID-19, which later led to me being nominated for the Best Media Award or Presenter Award in 2020 for I think that's the Zambia research team. I think I can't remember the full names for that. So I was nominated for that and I came out second, and I think I lost out to my good friend who's Lucy Nambela from Capital FM. But through that, I've been passionate about reproductive health. So if one is going to Google and check online about Wankumbu Mkonda, the first thing, for instance, if they are going to go to Facebook, they'll see Wankumbu and condoms. Others are going to see on LinkedIn, Wankumbu and HIV, and all that. So after graduating from the University of Zambia, I joined Corporal Zambia, where on the youth care project, I worked as a project and communications coordinator. Thereafter, I joined on the same project. I joined Pediatric Adolescent Treatment Africa, where I am now and operating as the field technical advisor for both Lusaka and Copperbelt provinces. And really, that's me being here as a project and field technical advisor on the youth care project. And the youth care project is really about self-care. The project promotes self-care as a concept of individuals, families, communities receiving or seeking health services with or without or with minimal supervision from healthcare providers. And this concept really, for instance, here in Zambia, was much pronounced around 2020 when we were hit by COVID-19. And we said, how then are people going to access these services with little or no support from healthcare providers? And that's why now the Youth Care Project, which is being funded by AIDS funds, is really paramount in that it is promoting that concept of saying, can Priscilla, can Wankumbu, I see that I think we have people like Ngao on the call, can they really live a healthy life without support or little support from healthcare providers? And so this is, I think, where we are, and I'm looking forward to even delving much deeper into this conversation. Priscilla, thank you so much.
All right, thank you so much for that, Wankumbu. Actually, as you were speaking, I just thought of something. I think we're all curious to know what is your go-to self-care technique as Wankumbu Simkonda?
Thank you so much, Priscilla. My go-to self-care either is listening to music or going to the stadium to watch soccer. Right now, the team that I support has been in controversy and all that. And it's a shame that some of our friends have become hooligans, and that's really unacceptable. But soccer is my go-to self-care. I enjoy being around people because it helps me take off that stress by being around other people that will encourage me to be a better person, but also just enjoy the warmth of others. And when I mention that, Priscilla, is that, sometimes when you're alone and you feel stressed or distressed, or you feel some sort of anxiety, you're going to find that the more you spend time alone as an individual, it's really going to take a toll on your mental wellness. So for me, I prefer being around people. I prefer being around a lot of people and just to have fun. So either listening to music or going to watch soccer. Yeah, so I think for me, that's that.
Okay, thank you so much for that. That's good to know. I'm not seeing any comments yet or contributions in the comment section. Please, let's keep this engaging. Do share some of your self-care techniques that you do, so you can drop them in the chat box and we'll be able to read them out. Just share and at least maybe we can learn one or two things. Actually, I think I remember probably yesterday or the other day, I heard someone saying that they tried a self-care technique which involves maybe taking long drives somewhere serene. But then by the time they were coming back, they were actually even more frustrated because of the frustration that goes on the road, road rage and all that. So for them, they were like, you know what, this is not a self-care technique that I'm choosing to embark on. I think this is the first and the last time. So yeah, please do share your self-care techniques. I think for me, one of them is just like Wankumbu said, listening to music. But apart from that, I do love being around nature, being somewhere quiet, being somewhere very far. I'm an introvert, and I say it with inverted commas because most of the time, after engaging with people, they're like, "Are you sure you're an introvert?" And it's true that you're an introvert, but I feel after I get comfortable with people, yeah, the real me comes out. But apart from that, it's a bit difficult to navigate your mental health as someone who's on the quieter side because people will think, okay, this is just how they are. Even the shift in behavior, even when you feel a bit depressed, people will just think, okay, this is just how this person is. But that is why I appreciate platforms this where we can come together and actually just be ourselves and be able to share one or two experiences. So please feel free to interact, to engage, and also share with anyone you think would benefit from this session today. Now, moving on, Wankumbu, how would you define self-care, especially with regards to young people and mental health? Not too long ago, I'm not sure of the statistics, but I noticed a post that mentioned that a number of young people commit suicide. I don't know if it's monthly, that is in Zambia. And we're trying to understand what is going on with young people. What is the issue really? What is the problem? So are you able to explain to us how you define care with regards to mental health, especially among young people?
Yeah, thank you, Priscilla. And even before I comment, I'm so excited to see among other people that have joined this call. I see that my colleague, Dr. Teles, is joined this call, and I also think my friend also Benny has joined, and I do thank you, colleagues, for the support on this call. And coming back to your question, Priscilla, when we talk about self-care, I hope that Dr. Teles will be able to agree with me how that's panning out in Mozambique, and also from friends that have joined on this call, is that self-care on this aspect really, and also maybe let me say on the youth care project, is just about us trying to describe a concept that tries to empower an individual, a household, a family, and a community, just for these individuals to really take care of their own health with little support or with no support healthcare from healthcare provider. Yeah, so that's really self-care. But then when you go to young people, for young people, it's just about can a young person make decisions around their family planning choices? Can they make their own well-informed choices about, for instance, termination of pregnancy? Can they be assertive to say no to unsafe sexual behaviors from their sexual partners? And all this really being interlinked to one's health and one's well-being. And based on what I've shared, Priscilla, is that when you look at that, you're going to say, if I'm going to make an informed decision around my family planning issue, then I need to be informed. If I have unprotected sex, for instance, today with my sexual partner, or together, we should be able to discuss to say, my love, babe, are you going to be able to take an emergency contraceptive pill? Are we going to make an informed decision to ensure that we use a condom? Are we going to make sure that, for me who's always on the move, is my sexual partner going to make sure that they make an informed decision, or I do make an informed decision to use PrEP before our sexual interaction? So all these aspects, especially to adolescents and young people, speak to how a young person should be able to have information, and information really is at the center of self-care, if you ask me, because without knowledge, then you cannot practice self-care. Then you cannot go to the gym, you're not going to take a walk, you're not going to listen to music, you're not going to go to a stadium to watch soccer, so that you take away the stress. So for me, that's how I define self-care. And remember, at the center of it is information. And that's what we are trying to do on the Youth Care Project, which is supported by AIDS funds. We are trying, through our in-country partners, trying to ensure that we raise awareness. Young people between 10 to 24 years old are informed and they make the right choices. They have got access to family and contraceptives, or SRH and HIV commodities. And when they have that information, then we also lobby and advocate that there is access to family planning and HIV services.
Awesome. Thank you. And I just like how you've sort of merged, sexual reproductive health, you've merged it into self-care. And I think that's something we overlook most of the time, because we think these are two independent topics. But your sexual reproductive health does definitely affect your self-care one way or another. And also, quote unquote, you have said information is at the center of self-care. And that is true, because if you do not have information, it's very difficult for you to practice self-care, because you need to actually know the good self-care practices, which actually reminds me of, I think, a conversation young people were having about what techniques they use with regards to self-care. And someone said, you know what, I just drink alcohol. I drink and drink until I black out. And after that I feel better. And then we're like, well, there was a whole debate to say, is taking alcohol a form of self-care? Because others say, it makes you feel better, it takes you away from your problems. But then others say, it's a bad vice. So before we continue, are you able to speak into that? Is alcohol a form of self-care? Alcohol consumption?
No, no, no again. And alcohol, the substance, other young people are using cocaine, others are using weed or marijuana. When you go to anything that either says you or depresses
I think we've lost Wankumbu. I think he's dropped out, but hopefully he'll be able to join us. Wankumbu, are you there?
Okay, I think I dropped off the call. I don't know what could have happened with my network. Can you hear me?
Yes, we can hear you clearly. Thank you.
Thank you so much. I was that alcohol or drugs or substances, these are either depressants and some are suppressants. So when you look at that, it shows you that an individual has really missed out an opportunity, because when one gets intoxicated, I think I was just writing somewhere as I was preparing for this event, is that I've heard stories. I think the other day I was at the University of Zambia, where I was having a lecture with students from the School of Education, where I was talking to them about gender-based violence and mental health. And what stood out in that case was, what is the go-to issue amongst adolescents and young people when it comes to them distressing and all that? And alcohol came out as a key issue. Yeah. But when I asked and probed further to say, those of you that, for instance, have watched pornography, that have gone to drink beer, you go smoke weed, have space cakes and all that, how did that turn out to be?
Apologies for that. I think Wankumbu is having challenges with his connectivity, his internet connectivity, but I'm sure he'll be able to join us. Okay, I think I see him. Wankumbu, are you there?
Can you hear me? Can you hear me?
Yes, we can hear you, Wankumbu.
Okay. Sorry. I don't know why I keep getting kicked out and all. But yeah, I was saying, you find that, try and make this point quickly, that you find that young people resort to that, but in the end, they either get to be abused after being intoxicated, and the resultant of those is where someone either forgets to use a condom, whether someone forgets to ask their sexual partner on either maybe, let's say, asking their HIV status, or knowing and wanting to be assertive about their reproductive health rights. So I think intoxication or alcohol is not a go-to activity because it impairs your judgment. Priscilla, you and I will be able to make an informed decision today to say, look, Wankumbu, I don't know your status. We are not going to do this without me knowing your HIV status, okay? We are going to have an honest conversation around making sure that we use protection, for instance. So, intoxication really makes people have impaired judgment and get involved in risky sexual behavior. So I think that's what I would want to say. Yeah, and also Priscilla, allow me to acknowledge Dr. Puri Gonzalez as well from Mozambique, who has joined us. Dr. Puri, thank you so much for joining the call. Over to you, Priscilla. Can you hear me?
Yes, thank you.
Okay, thank you so much. Over to you.
Okay, thank you so much for the acknowledgement. But also I'd like to say thank you so much to everyone who has for this. Remember, this is our very first Thrive Aid Wellness webinar. So it does really mean a lot that you could spare time and be here with us. Now, remember, we are discussing substance abuse, self-care, mental health, and we are trying to break that cycle, especially among young people. And so if you've got any comments, any remarks, please do put them in the comment section in the chat. If you know someone who would benefit from this session today, please do share the link with them, and be sure to follow us on our social media platforms. That is Thrive Aid. We are on Facebook, we are on YouTube, we are also on LinkedIn. So thank you so much once more for joining us and being here today. And I am joined by Wankumbu Simukonda. Now, even as we continue the discussion, Wankumbu, we've talked about some of the bad, I don't know if I can say bad self-care techniques or techniques that people think but they're actually not try to look into some self-care techniques that especially young people overlook, but could actually help them in the long run. What self-care techniques could you recommend, or do you know that young people overlook but are actually beneficial?
Okay, thank you so much, Priscilla, for sharing sharing that thought. And I almost went to sharing because I know that Sister Chile Shemsonda is on this call. And I think when I was at our facility, we did discuss some of the activities or the interventions that some of these young people are trying to put up. Like I said at the beginning, is that self-care. For you to practice self-care, you need to have information. So information is at the center of self-care, and that's why for us as PATA and our implementing partners on the youth care project in Kenya and here in Zambia, we are trying to ensure that we do raise awareness amongst adolescents and young people, especially those aged between 10 to 24. And why this is important is that when a young person is aware of where to go and get or access information or services, then this young person will subsequently reduce the stress on him or the burden on the healthcare providers and all that. Because then we know that if a young person is not being assertive to say no to unprotected sex, then after that, then they can go to a morning after pill. If then they fail to do that, then they can go and take PEP. Or if they know that they are going to be in a risk relationship, then they can take or have access to PrEP. And even in that instance, they should then be able to go to a health facility and access services around SRH and HIV services. So for me, information is at the center, but then young people should be able to share information amongst themselves. I always say information shared or problem shared is a problem solved. That's not really it. But I say a problem shared with the right person is a problem solved. Today, Priscilla, if I was going to share my problems with you about my relationship, or if you're going to share your problems with your relationship as young people, then if you find any similar post on my status related to relationships, then you're going to say, I shared this with Wankumbu, and now he is sharing with over 400-500 people that are going to view his status. So I encourage young Priscilla, can you still hear me?
Now.
Can you hear me? I can hear you.
Hi, Wanko.
Yes, yes. Well, it shows that
Nasafu atuza tene tweneliza tonse tieni doti mamboni kanomo.
As we wait for Wankumbu to get back, I think his internet. If you're just joining us to our very first Thrive Aid Wellness season, in this series, we are going to be discussing all things sexual reproductive health, mental health, gender balance, you name it. Now, Wankumbu,
yes, yes, Priscilla.
okay, are you?
Yes, I'm back. Can you hear me?
Okay, we can hear you now.
Okay. I don't know what's happening to my network, but yeah, I'm on the call. Felicity, are you there? Can I see some thumbs up if anyone can hear me? Okay, it seems that okay. Yeah, thank you so much, Vene, for that. I see that maybe our moderator is off the call, but maybe based on what okay, thank you so much, Jackson, as well, for acknowledging that you could hear me. I see that our moderator's mic is off, so maybe she's trying to join back. But based off what I've shared, how has been your experience, colleagues, with self-care in your various communities? Because I think I would want to get some encouragement from the chat, because like I was saying earlier on that when I was having a lecture at the University of Zambia on GBV and mental health, what really stood out was the fact that even amongst students who are at the highest learning institution, sometimes may lack information about their own health. Therefore, it becomes problematic to seek help or seek for support. As a result, we need those of us that are privileged to have this kind of information. We may need to ensure that we scale up, escalate this information sharing with our friends so that then they can make informed choices about their sexual and reproductive health, because SRH and HIV is really linked to issues around mental health, and as such we need to look at our mental health, we need to look at our SRH and HIV services and ensure that these are interlinked and integrated for us to make informed decision. But without that kind of information on how our SRH, HIV, and GBV or mental health affect us, then it's going to become problematic to seek help. Therefore, I really encourage that we need to seek help, and we can only do that only and only if we are informed. I don't know, Priscilla, if you are back on the call, but I see that I see a comment from Bene. Priscilla, are you back?
Okay, I think I'm back now. I dropped off.
Okay, thank you so much. I think there's a comment from Venage Temper.
Okay, are you able to read it for me? I think I'm not able to see it from my end.
Sure. So I think Bene says, in a fast-paced world, now is the time for young people to know how to care for themselves and make informed choices. I don't know if you're able to see now the comment from Joshua.
Yes, I can see Joshua's comment. Thank you for that. So Joshua says, I totally agree 100%. I feel it's our job as the youth coming up to have an enabling environment, creating safe spaces for people to pour out their emotions and so on. Very valid point, Joshua. Thank you so much for that comment. Now, please do keep the contributions and comments coming in. If you have any questions, feel free to drop them in the chat box and I'll be able to attend to them. And if you want to say something, if you want to speak out, please feel free to raise your hand and we'll give you some time to make your contribution. Now, it's been up and down with the internet connectivity on both my end and my speaker's end, but I'm glad to see that we're trying to forge ahead. Okay, moving on, Wankumbu. I don't know if you've summed up what you wanted to say under that question, even before we move into the next one. But I think something that came to mind as you were speaking was we're talking about information and it being at the center of self-care. But we find a number of times young people are not able to access certain self-care services because they just don't have access to them within their community or fear of stigmatization or discrimination. So then how do we then handle that? Because a young person will want to have access to condoms or to contraceptive pills, but then if they go to a healthcare facility, they will be given a lecture because healthcare practitioners will take up the shoes of a parent and not a healthcare provider. So then how do we address that? Because I think I've had a number of conversations with young people, and that's usually the problem that comes up to say, I can't go to a healthcare facility because I'll find someone who will begin to scold me to say, but what do you want condoms for? What do you want morning after for? So then how do we address that? Because we're saying that's self-care, but then how do I practice self-care if I'm not able to access it freely?
Okay, thank you so much, Priscilla. And I'm so passionate about this question that you've asked, but also even in terms of what it is that I'm able to discuss now. First of all, I'll share one approach that we use at PATA, Pediatric Adolescent Treatment Africa. We use a tool which we call the scorecard. This is a client satisfaction tool. And we use this tool to get feedback from adolescents and young people who receive services in these 10 facilities, for instance, in Zambia, in 10 facilities in Tanzania, and in 13 facilities in Kenya. And when you look at this tool just helps us get real feedback on the ground from the adolescents and young people accessing these services from these facilities and where we are working. And when we get this feedback, and this feedback is gotten by adolescents and young people themselves from about 20% of the total inflow young people that are accessing services in that particular month. And when we do this analysis with our MIE then we give feedback. And based off the feedback that we share with facilities, then we develop what we call a quality improvement plan. And why is this important? Why have I given that example or concept that we use as PATA? Is because adolescents and young people have got their different needs. And these needs are supposed to be met with different approaches, with a desire to continuously improve in the service delivery. So this tool is very important, because when you look at how facilities over time have been able to realize that when, as a facility, young people are complaining about staff attitude and behavior, then you're chasing them away from accessing these services. And when that happens, then service delivery becomes problematic. And this is why now we say, can our trained healthcare providers be able to provide services in a youth and user-friendly manner? And we support as PATA, as implementing partners on the youth care project, even from, I think I've seen that Madam Lacey Azia, who's a PATA healthcare provider champion, as well as Kitwe District Health Adolescent Focal Point person who has joined us, who have been able to support us in that cause. So for me, really, it's about, like I said, information at the center of it, deliberate interventions, which can even be data informed to make some of these choices and interventions to ensure that we continuously develop and improve our service delivery to adolescents and young people. Even at the start, Priscilla, you asked me, why is this important, especially for adolescents and young people? It's simply because this stage is the most delicate phase of one's life, when one tends to explore, want to test things and all that. So in that aspect of exploring, if information is lacking or is missing, then we are going to see young people going to take up choices that they are going to regret at the end of the day. So for me, it's all that put together.
Awesome. Thank you so much for that one, Kumbu. Now, if you're just joining us, you're welcome. And we are talking all things self-care, mental health, sexual reproductive health. And we are joined by a very special guest, Wankumbu Simukonda, who is trying to break down self-care. And quote unquote, he did mention something that I think we can take away to say information is at the center of self-care. So I think we need to put his name under that quote to say information is at the center of self-care. Now, remember, Thrive Aid is a youth-focused nonprofit organization whose focus areas are mental health, mentorship, and education. So if you're just joining us for the first time, please do follow us on our social media platforms just to get a feel of what Thrive Aid is all about. Now, moving on, Wankumbu, would you say that there are some probably digital apps that speak into self-care currently in Zambia and beyond? Are there any apps that have been created that look into self-care?
Thank you so much, Priscilla. When we talk about the digital space, I think this has been a fast-paced moving. Now we have got robotics, now we have got artificial intelligence. And with regards to self-care, and like I said, thank you so much also for ensuring that you put a scholarly aspect to the aspect of information being at the center of self-care. because when you talk about digital space, we are really talking about access to information. And I'm happy, I think over the years, is it in 2022, we had about 4.4 million Zambians accessing internet, or about that percentage there, about having internet penetration. And what that means is that instead of you, Priscilla, and I just having this call where we are discussing issues to do with self-care, when we throw this on my Facebook page with over 5,000 followers, when you throw it on ThriveAid, when you throw it on YouTube, more people other than the friends and colleagues that have joined us on Discord will be able to access. So when now we go to using these digital tools, you find, for instance, for example, I'll start from home. At Pata, we have got the Pata Hub, and the Pata Hub is a platform that brings healthcare providers, and these are frontline health workers, who sit together, share information, share their different experiences and challenges that Hello, Priscilla, can you hear me?
Okay, yeah, we can get you now.
Thank you so much. So I was saying that from home at Pata, we have the Pata Hub, and this is a platform where healthcare providers, who are frontline health providers, champions, meet and share their different lived experiences. And this is a platform for healthcare providers who are working in their various different and harsh conditions to ensure that they provide the service to us, where they share experiences, motivations, and encouragements. Similarly, with self-care, there are a lot of platforms other than the Pata Youth Hub in country. For instance, here in Zambia, we have got WhatsApp groups, and these are digital platforms. We have got Facebook groups, Facebook communities, where people, healthcare providers, adolescents, and young people share in their most private scenarios their lived experiences, that they are able to even seek help. So for me, there are a number of platforms so that I can remember. I know that I think CIDAS, for instance, has got a platform where they share information for adolescents and young people. It should be under, is it under the Checkup One project, for instance, and many other chatbots. I think there was a 1.8 billion what young people want campaign. And when you look at all those platforms, the chatbots, all these have proved to be platforms for young people or individuals to share their lived experiences, and also being able to seek help and support with regards to the challenges that they have in their lives.
Okay, thank you so much for that one, Kumbu. Unfortunately, I think the network is still a bit shaky. We were hoping to go almost even an hour, 30 minutes, because I think this is really an interactive session, and we would have loved to go like on and on and on, but we would try just to conclude in the few minutes that we have, so that at least we can capture you for the very few minutes left that we have with your internet connectivity. Now, as you were speaking, I think something came to mind with regards to the involvement of young people when it comes to creating these apps, when it comes to creating these self-care tools. Would you say that you've mentioned the Pata Hub, for example, you've mentioned some apps maybe run by siders. Do you think these apps are user-centered? And when I say user-centered, I mean, do you actually put young people at the heart, at the core, at the center of the development process, because I think nothing for the people without the people, right? So is this something that you consider? And if so, how beneficial is it to actually involve young people in this development process?
Thank you. Thank you so much, Priscilla. I hope that the network will be kind to me as I share this point. Is that, for instance, us at PATA, we have the Youth Advisory Panel, and this Youth Advisory Panel, of which some of them, like we have got this Youth Advisory Panel being represented in the PATA board, and these young people from different countries, Zambia, Cameroon, Zimbabwe, and many other countries where PATA has got presence, are represented on that. So whenever we are making a decision to have them contribute to the development, for instance, of the PATA hub or the structure or commenting, young people are involved. And with that, it's not only just about young people being involved, it's having the young people meaningfully contribute to the development. Like you are saying, Priscilla, nothing for us as young people without us. It would not have meaning if young people are not at the center of it. We don't just want to have young people participating in a tokenism manner or tokenistic manner as per Einstein's ladder of participation, but we want young people to be in control of these platforms, because someone who's a millennial or a Gen Z, they may not be able to speak the same language when it comes to information sharing or interaction. But if a Gen Z is part of the development of the Gen Z platform, then this young person is going to be representative of what other young people feel or the aspirations that they share. So for me, really, it's about meaningfully engaging the young people in the development of these self-care platforms, self-care interventions, because a Gen Z, a millennial, they have got different aspirations and different interests. So what will be meaningful to a millennial may not be meaningful to a Gen Z. So for me, it's about really meaningfully engaging the adolescents and young people in the decision making of these self-care platforms. Thank you.
Okay, thank you so much for that, Ramkumbo. Very valid points. Actually, I was laughing when you were saying what a Gen Z will want is different from what a millennial will want. And I mean, when we look at social media nowadays, Gen Zs, we are all over the place making noise. So what we want might be different from what millennials and others would want. I also just wanted to make mention that I think the use of social media, just as we are doing as Thrive Aid, just as we are doing here, Wankumbu, is a really powerful tool, apart from the digital apps, but we could also be champions of self-care. We could also be champions of mental health on our various social media platforms, even our personal ones, okay? We can spread the word, we can spread awareness on mental health, on self-care, even on our social media platforms. We could really use social media as a very powerful tool. Now, even as we wind up this session, Wankumbu, are you able to just give us, like, as in closing remarks, with regards to closing remarks, what gives you the most hope right now with regards to self-care transforming the mental health landscape among young people? How do you think self-care can be able to improve the state of mental health among young people in Zambia and beyond?
Thank you so much, Priscilla. And what gives me hope is the fact that post-COVID-19, there has been an upscaling. You find that the World Health Organization did develop guidelines for self-care, because the World Health Organization really said, look, the healthcare workforce is stressed with a lot of human or clients that they are supposed to see. You find that one medical doctor is seeing a whole lot number of people, a nurse is seeing a whole lot number of people in a day, and this takes a toll on their mental well-being as healthcare providers, and it really stresses them. So when the World Health Organization came up with the concept of self-care with its partners, they said individuals, communities, and families should be able to manage their own health with little or no support from healthcare providers, provided that these individuals do have information. So over time, post-COVID-19, we see the aspect or the concept of self-care being promoted by a number of institutions, organizations. I'll give you an example. For instance, what we are doing on the Youth Care Project. We have got PATA, we have got Y Plus Global, we have got ARASA, we have got Coparo Zambia, we have got CDF in Tanzania, we have got NAYA, we have got IREP in Kenya, and many other organizations coming on board, creating a consortium to just ensure that they amplify the message of self-care. And this gives me hope, because today, if I was going to find myself in an eventful, over this long weekend, in an eventful 10 of things where I find that I'm exposed to HIV, I should be able to seek help tomorrow morning at a health facility, or later tonight at the health facility, and say, I think I am exposed based on A, B, C, D. Can I get PEP, post-exposure prophylaxis? If, for instance, you find yourself in an eventful things, Priscilla, you have unprotected sex, you should be able to make that rightful decision. And you can only do that by having that information. So we need stakeholders, we need NGOs, civil society organizations coming on board to amplify this message. Because during COVID-19, we saw that health services were almost disrupted. If I should say, they were disrupted. But with self-care, then we are going to have reduced numbers of people going to the health facility, which is already burdened with a number of people that they are seeing in these facilities. So for me, it gives me hope to see that there are a number of organizations like PATA, IRA, CDF, Copper Rose, and many more supported by AIDS funds that are amplifying this message of self-care.
Okay, thank you so much for that, Wankumbu, and a big shout out to all the organizations that Wankumbu has mentioned. Thank you so much for all the work that you continue to do. Now, Wankumbu, unfortunately, we have to come to the end of this session, but we really need to have you back as Thrive Aid. This has been really insightful. It's been enriching, and honestly, I think everyone else will agree with me that time has not been enough. Including the internet connectivity challenges. I think it stole a lot of time away from us, but I do believe we will definitely have you back here again. But just before we let you go, do you have like a few final remarks that you would want to make, even as we end this conversation?
Well, thank you so much. For me, it's just to encourage everyone who's on this call and everyone that is going to find time to listen to this conversation on YouTube, and that really we need to take care of our own health, because if we do, then we'll reduce the burden that we put on the already stressed health systems in our respective countries. So for me, your health is your responsibility. So, Priscilla, your health is your responsibility. Dr. Puri Gonzalez in Mozambique, Dr. Teles, Mozambique there. Please, your health is your responsibility. Joshua Jackson, a melody in the background, your health is your responsibility. Please take care of your own health. Self-care matters.
Awesome. Thank you so much, Wankumbu, for the time that you've given us today. We truly have learned a lot, and we hope to have you soon enough.
Thank you so much. Looking forward to more interactions. I'm so passionate about the aspect of self-care, and really these are conversations that I would want to encourage every one of us, young people, the older generation, to ensure that they take time to take a walk, take time to run, take time to listen to music, jog if you jog, participate in those events like the marathons and all that, so that you are not always being stressed. So for me, your health matters and self-care matters. Thank you so much.
Awesome. Thank you. And there you have it, everyone. Even as we have come to the end of today's session, I just want to say a huge, huge thank you and truly for showing up today. Now, these conversations around mental health and wellness, sexual reproductive health are not always easy, but they are really important. And your presence here today means that you're part of something bigger. You're a part of a community that values and it cares for healing and collective growth. So once more, thank you so much for joining us and for being here. Do remember that you can still catch the recording of this session on our YouTube page. You can also find it on Facebook, and you can also check us out on our LinkedIn platform. Now, a huge thank you to our speaker once more, and also to the Thrive Aid team, and of course to all of you just for engaging with us. I feel that this is just the beginning. Remember, this was our very first Thrive Aid Wellness webinar, and we'll be continuing this series with more powerful discussions and practical tools just like the ones we've discussed today. So do stay tuned and spread the word. Now, remember, if you've watched me before, I always say that I don't end a session without a quote. And at least today, Wankumbu gave me a quote. We have a scholarly quote today, which says, information is at the center of self-care. This is something you must not forget. Information is at the center of self-care. So do remember, your health, your responsibility. So until next time, please do take care of yourselves and one another, and let's keep thriving. Bye-bye.